si elevator, si te namin yung takaro, similado caro. Yo más se tono le me atate still pick recommend, a recommend. Cause prepidi, your smile, you put your stay to sanya, ni naro kabilay, maro bigyan. Oh, bigyan. Si elevator, si te namin yung takaro, similado caro. Yo más se tono le me atate still pick recommend, a recommend. Cause prepidi, your smile, you put your stay to sanya, ni naro kabilay, maro bigyan. Oh, bigyan.
Good afternoon, everyone. The coronavirus disease outbreak, which started in Wuhan, China, has reached the Philippines on January 30th, 2020. The effects of it left everyone unprepared and surprised. This has led the government to launch multi-sectoral approach or response in response to the effects of the COVID-19 pandemic. So for today's webinar entitled E-Governance, Naga City Connecting to its People Amidst the COVID-19 Pandemic, we will try to explore Naga City's governmental effort in pacifying the effects of the COVID-19 pandemic. Most specifically, the strategies, the programs, the initiatives employed by the local government in strengthening its connections to its constituents by integrating information technology as a pivotal tool in governance in this new normal. Okay. I am Eliza Joyce Alarcon, your host moderator for this webinar. Okay, but before we begin, I'd like to give you a quick rundown of our event because we will be having three parts. The first part will be the talk of our speaker. The second one would be the sharing of reactions and insights from our invited panel of reactors. And then lastly would be the open forum. So for the open forum, questions will be coming from our participants who are watching live via Ateneo CLD Facebook account and Ateneo CLD YouTube account. All right, so participants who are watching now may start writing down their comments on the comment section box because that will be opened later in the plenary during the open forum. All right, so to begin, may I now call in our Director for Center for Local Governance, Dr. Malu Barceliano, to give her welcome remarks.
Good afternoon, everyone. Good afternoon to our viewers who are watching us via the Ateneo CLG YouTube channel and the Ateneo CLG FB account, as this activity is being streamed live through these platforms mentioned. I am pleased to welcome you all to our webinar entitled E-Governance, Naga City Connecting to its People Amidst the COVID-19 Pandemic, with the local Chief Executive of Naga City, Honorable Nelson LEGACION, as our guest speaker. The United Nations describe an e-government to mean everything from online government services to exchange of information and services electronically with citizens, businesses, and other arms of government. Traditionally, e-government has been considered as the use of ICTs, information, communication, and technology for improving the efficiency of the government and providing government services online. Lately, it has broadened to include the use of ICT by government for conducting a wide range of interactions with citizens and businesses, as well as open government data and use of ICTs to enable innovation in governance. Thus, the e-government can thus be defined as the use of ICTs to more effectively and efficiently deliver government services to citizens and businesses. It is the application of ICT in government operations, achieving public ends by digital means. The underlying principle of e-government, supported by an effective e-governance institutional framework, is to improve the internal workings of the public sector by reducing financial costs and transaction time so as to better integrate workflows and processes and enable effective resource utilization across the various public sector agencies, aiming for sustainable solutions. Through innovation and e-government, governments around the world can be more efficient, provide better services, respond to the demands of citizens for transparency and accountability, be more inclusive, and thus restore the trust of citizens in their governments. In the case of the local government unit of Naga City, its iGovernance program, which is focused on the use of information technology tools to improve governance, has started even before this pandemic. The use of the internet and mobile technology to improve service delivery to its constituents started as early as 1997 when the city's website was first launched. The city's website provides information about the city's tourist spots as well as Naga's various awards and governance initiatives. It promotes community through news features, fora, and live webcast of important events. One unique feature of the site is the Serve Naga component, which is a tool for pinpointing accountability in service delivery. Another feature of the Naga website is its Share Naga component, which posts ordinances and executive orders, procurement and outcomes, as well as budget and finances. There is also the Naga City Citizens Charter, which is a guidebook on the local government's key services. The guidebook offers step-by-step instructions on how to use each service, the standard response time for its delivery, and the City Hall officers and staff responsible for its operation. Naga's ICT initiatives have led to it to receive various awards. In 2006, it won the Most Business-Friendly City Award from the Philippine Chamber of Commerce and Industry, which elevated it to the Hall of Fame after winning the award for 3 consecutive years. Naga is also a Hall of Famer of the Asian Institute of Management Ford Foundation, Galing Pook, which is the Innovations Program Award, and the Presidential Gawad Pamana ng Lahi Award of the Department of Interior and Local Government. Our resource speaker, Honorable Nelson LEGACION, will share more about this program, especially as to how it is utilized in this time that we are in pandemic and in this new normal. So let us all learn about the e-governance practices of Naga City this afternoon. And let us all be inspired with this line from Rohini Nilikani, citing that we cannot be more consumers of good governance. We must be participants. We must be co-creators. With this, I formally welcome you all to this activity. Again, marhay na hapon sa Saindo Gabos.
Thank you very much, Dr. Malu Barceliano. Now, to formally introduce our guest speaker, he is the new mayor of Naga City and vows to bring closer to the people the city government of Naga and to create a more enabling and more empowering environment for the Nagaños. Captured in his administration slogan, nalalauman, nasasarigan, nangangataman. His leadership directions focus on making Naga a self-reliant and caring city. His career as a public servant began July 2, 2001, when he was appointed as City Legal Officer by the late former Naga Mayor and Interior Secretary Jesse M. Robredo. As Counsel of the People, he successfully prosecuted expropriation cases that resulted in the distribution of residential lots to urban poor beneficiaries. He also scored a legal victory at the Supreme Court, resulting for the management and administration of Plaza Rizal to be finally granted to the city government. For his accomplishments and love for Naga, he was elected by Nagaños for 2 terms in the City Council, 2007 to 2010 and 2010 to 2013. As councilor, he brought his life experience in the Sangguniang Panlungsod and pushed her legislations that help uplift the socioeconomic status of the destitute and underprivileged. Proving himself as an excellent legislator with a heart for the Nagaños, especially the underprivileged, he was chosen by the people to be the city's vice mayor. As presiding officer of the Sangguniang Panlungsod, he introduced reforms on 2 key points. First, the promptness to pass sound legislations responsive to the needs of the changing times. And second, capacity to enact so-called welfare legislations along the spirit of the words of President Ramon Magsaysay, that he who has less in life should have more in law. So when not wearing his hat as public servant, he is an affectionate husband to his wife, Attorney Marian Eloisa Legacion, and the loving father to 4 children, namely Nathaniel Emil, Neil Emerson, Nadine Aina, and Natalie Eman. So may we now welcome Attorney Nelson Legacion.
Marhay na aldaw sa gabos. It is an honor to be invited by Ateneo de Naga University to speak in this webinar that aims to explore how the city government of Naga is using electronic and other technological means to connect to its people at the backdrop of this COVID-19 pandemic. I hope that this presentation of mine will help advance your knowledge on how we can continually deliver effective public service and even improve the same despite the challenges of the present public health crisis. I am Attorney Nelson S. Legacion, Mayor of Naga City, the heart of Bicol. Our city is the regional center for economic, educational, and religious activities. It is also the core of Metro Naga, an alliance between the city and its neighboring local government units, with a combined population of around 600,000. The last 22 months have been challenging for Naga, marked by events that tested the resilience and capability of my young administration, which only assumed office in June 30, 2019. In December 2019, we faced Typhoon Tisoy, which sparked 165 km per hour winds. From October 25 to November 11, we grappled with succession of 3 typhoons, Quinta, Rolly, and Ulysses. The second of which, packing winds of up to 315 km per hour, was the strongest typhoon of the year 2020. In February 2020, we grappled with the African swine fever, hammering local hog raisers and the swine industry. And from March 2020 to the present, we had to deal with the COVID-19 pandemic that continues to be a major threat worldwide. Online registration of volunteers. This is the first concern. Indeed, on March 16, 2020, the national government, faced with a growing number of cases in Metro Manila, decided to impose an enhanced community quarantine or a hard lockdown for the whole Luzon Island. People were instructed to stay at home, most businesses closed, and public services wound down except those deemed critical. We were caught off guard by that sudden decision. As early as December 2019, we knew that there's a dangerous new disease consuming Wuhan and later most of China. The slow-moving biological hazard was spreading worldwide, but unlike our Southeast Asian neighbors, the national government did not quickly close down our borders. So, when things got out of hand, a hard lockdown was suddenly imposed as a precautionary measure. The imposition of the hard lockdown was a gargantuan challenge. We need to ensure that the activities of individuals outside their homes were limited to those deemed essential. Transportation of people within the city and those going outside and those going in was policed and restricted. The city's manpower will not be able to cope up with the demands of existing circumstances. But thanks to those who registered online, the heroic 1,700 plus warm bodies and volunteers from national and local government agencies as well as private sector partners, guided by the incident management team that directed our response. we were able to fulfill the challenging tasks. We made a call for volunteers through Facebook, the most popular social networking site in the country, and invited them to register using Google Forms. The hardworking and dedicated volunteers were responsible for quickly imposing lockdowns where necessary and adopting policies, some of them well ahead of the national government. They aided us in providing transport, food, and accommodation to our frontliners, especially our health workers, powered by vehicles made available by schools like UNC, Ateneo, and Naga College Foundation, industrial kitchens provided by Viscas, foodstuff and cook organized by the Metro Naga Chamber of Commerce and Industry, and rooms by Sogo Hotel, the Viscas Hostel, and several other local lodging facilities. The experience, and along with it, the lessons we had in handling the pandemic during the hard lockdown allowed us to develop our local capacity to manage the pandemic in various dimensions. In partnership with the National Resilience Council, we established a local COVID-19 dashboard which is being updated daily. The dashboard consists of a two-deck table of key indicators on COVID-19. Number of confirmed and active cases, recoveries and deaths in the first deck. These are pretty straightforward and self-explanatory. The second deck is a little more complicated. They consist of case doubling time, mean reproductive rate, critical care utilization rate, and positivity rates. Allow me to go through them quickly. CDT is simply the number of days it takes for COVID-19 cases to double. It measures the speed of disease's outbreak. The smaller the number, the faster the growth. Conversely, the higher the number, the slower the growth. R measures a disease's ability to spread. More simply, it refers to the number of people that one infected person will pass on a virus to on average. According to BBC, the measles virus has an R of 15, meaning one infected person can infect 15 more people. The SARS-CoV-2 virus, which is behind COVID-19, has an R of 3. Once the R number of any disease consistently goes below 1, it means that the virus' ability to transmit will eventually peter out. Since we track mean R beginning August, we have mostly hovered below 1, except for 2 periods in September and then the recent holiday season, starting in late December 2020 up to early January 2021, where cases again flared up, including the more recent. CUR measures the extent through which critical care resources are being used. In Naga, we have been monitoring 2 CURs, one for quarantine facilities and another for hospital care facilities. The numbers are color codes using IATF guidance. It is green, indicating safe zone for CURs 30 and below, orange indicating warning zone for CURs between 30 to 70%, red indicating danger zone for CURs above 70. Positivity rate measures the percentage of individuals who turn out to be COVID-19 positive as against the total number of individuals tested. In Naga's case, our average positivity rate hovers at around 10% since we started monitoring this indicator in early September. This means that compared to the ideal number of 5%, we still have a lot of work to do. This shows that while we are doing a good job at containing COVID-19, we're not out of the woods yet, as additional cases continue to be reported. Now, let's talk about Isalbar. Another technological tool that we developed to contain the virus is our Isalbar contact tracing app. Again, a demonstration of our robust public-private partnership strategy. This QR code-based mobile phone app was developed by Noika, the local company behind Hungrily and Community Mart. in partnership with the city's Information Technology Department. eSalvar allows us to track the spread of COVID-19 by capturing up to the third level of contacts with individuals suspected of having caught the virus. Armed with this data, we have implemented evidence-based local solutions and strategies aimed at containing the virus. eSalvar, literally to save, complements the city epidemiology and surveillance unit's traditional contact tracing method of calls and face-to-face interviews. Traditional contact tracing method depends on people's memory in identifying close contacts and fixing the day, time, location, and frequency of contact. It is time-consuming, inaccurate, or incomplete sometimes. But to be clear, eSalvar does not aim to replace CESO's system. Rather, it strengthens this by expanding the possible list of contacts in a timely and accurate manner, a key strategy for containing the spread of COVID-19. The approach is non-privacy intrusive and easily adaptable. eSalvar does not require smartphones, the internet, Bluetooth, or geolocation services. Individuals, whether residents or non-residents transacting in Naga, just need to register for their encrypted QR IDs through their smartphones, or for those who do not have cell phones, through registration centers that print the IDs for free. Contact tracing only starts when a person enters a business enterprise, office, institution, or any area of interaction called establishments. An individual just has to present his or her saved or printed ID to help security personnel who will scan the same using an app downloaded by eSalvar registered establishments. The scanner will indicate if a person can be allowed entry, meaning not a COVID positive, suspect, or probable, nor quarantined. It is also used to input high body temperatures or other visible COVID symptoms. These are sent as alerts to the city's Health Emergency Response Task Force. Entry into establishments is logged and sent to city servers. Constant connectivity is not required. Data connection is needed only at the start of the day to download the UUIDs and health status of flagged individuals, and at the end, to upload entry or exit logs and alerts for health F. Establishments have no access to clients' personal information. Previous data are deleted from mobile phones when these sync with servers. Personal information is processed only to notify an individual if he or she had possible contact with a COVID positive case. It is made available only to authorized city government personnel to facilitate contact tracing. Non-intrusiveness and an easily adaptable technology solution have led to high adoption. In less than a month, 79% of Naga's 200+ thousand population and more than 173,000 non-residents have secured their eSalvar IDs. More than 1,000 in 4,000 establishments have adopted eSalvar. In one day, the system averages 120,000 logs. Aside from the front-end application, eSalvar integrates the processes of other city units involved in COVID management. A back-end application with a user access management system is deployed at the CESO with lockdown teams, LSI and returning OFW facilities, testing centers, health monitoring teams, quarantine, and treatment facilities, and the social welfare office that provides food, assistance to people, and lockdown areas. This leads to better coordination and provides Health F with a clearer picture of the COVID situation, allowing it to make better data-driven decisions. Constant communication with the people using social media is important. But all of the endeavors we are doing to contain COVID-19 require cooperation of all stakeholders. And communication is key to encourage every person to chip in to our campaign against COVID-19. This we do by constantly informing the citizenry of Naga of present COVID-19 cases and policies and strategies. The city's official Facebook page, Naga City Government, and my own Facebook page, Mayor's Own LEGACION, are regularly posting details of COVID-19 patients, programs to alleviate the socio-economic impact of the pandemic, as well as health protocols and regulations that must be observed to halt its further spread. These Facebook pages also play a role in correcting misinformation. Of course, in the process of crafting our response, it was not always hunky-dory. We have to deal with politics and our political opponents who are trying to divide the city residents, compete with us in providing social amelioration services, and even cast aspersion on our policies, especially using social media as a platform. Our response is to always promote openness and explain the logic of our policy directions to anyone that asks. Of course, we cannot respond to every post on Facebook, but having a clear social media messaging and reliable platforms enable us to communicate our programs well and consequently rally support and cooperation. And by far, we are succeeding in our battle against COVID. And these are because of the following reasons. Unity of purpose, that's number one. Naga today is being led by a management team that has proven its mettle in its ability to deliver results. Dating back from the late Mayor and DILG Secretary Jesse Robredo in the late 80s, we pride ourselves with 3 decades of leadership continuity that helps achieve unity in the face of a daunting enemy. Second, active local civil society. Another element behind our success is the belief that the government will not be able to do it alone. This belief allows us to welcome and work with civil society partners with open arms, multiply our respective capacities and capabilities, and essentially do more with less. Number 3, a culture of open and science-informed decision-making. We believe that evidence should guide local decisions. We welcome debate on the pros and cons of any proposed policy or action, and because final decisions are science-informed and broad-based, there is generally a high level of trust that helps in the execution of local policies. Yes, we have slowly learned how to live with the virus, but this does not mean that we're on the clear, especially lately. To the contrary, we must always stand on guard for the worst-case scenario, especially that there are new variants of the virus. Time and again, we continue to hammer this urgent message. The battle is not yet won. This is not the time to be complacent and keep our guards down. The SARS-CoV-2 virus is still out there and is even mutating. And while substantial strides have been made to develop a vaccine, they remain out of reach due to lack of supply. We must still continually connect with the citizenry and convince every resident to be mindful of the 3 basics of the new normal at all times. Practice physical and social distancing, wear face masks, and maintain a high level of personal hygiene centered on regular hand washing. There is also the challenge of convincing city residents to be vaccinated if and when the vaccines, the necessary volume are already in. Right now, vaccine hesitancy is a significant concern, mainly because of the ill-advised tragic Deng-Baxia controversy. This year, the city has earmarked 50 million so that we can acquire vaccines and cover around 40% of our population, focusing on the 30 years old and above age groups. We are now finalizing our social media campaign to address the lingering hesitancy and accelerate our quest for herd immunity, if and when the vaccine comes. Leading the way forward, I am therefore grateful to have hardworking public servants and reliable local partners in the academe and civil society in our common effort to defeat COVID-19. Our thanks also goes to NRC and its partners at the national level for helping us build local capability and institutions to make evidence-based strategic decisions and investments toward that end. Moving forward, I am confident that in the background of this pandemic, we have been able to reach every Nagueño to do his share in ensuring a COVID-19 resistant Naga. Ciudadanong nalalauman, nasasarigan, asin nangangataman sa tahaw kan pandemyang ini. Diyos mabalos po, Naga na.
Thank you very much, Attorney Legacion. Okay, with all that being said, I'm sure Nagueños are very grateful to have you as mayor. All right, so at this point, we would like to acknowledge the presence of our faculty members and also students of Ateneo de Naga University, as well as participants coming from different sectors and institutions. We have, of course, Ateneo de Naga University, Cebu Normal University, Naga College Foundation, Taguig City University, Batangas State University, Ateneo de Naga University Senior High School, Department of Education, Bataan Peninsula State University, Xavier University, LTFRB, PNR Naga Station, University of Rizal System, Union of Public Administration Students or Pamantasan ng Lungsod ng Valenzuela, Camarines Norte State College, Leadership Education for Asian Pacifics, Booth and Partners Incorporation, BISCAST, Polytechnic University of the Philippines or Open University, Manila, Commission on Elections, LGU Bulac, Department of Public Works and Highways, Camarines Sur Polytechnic Colleges or CSPC, Mount View College, Partido State University, DAR Provincial Office Camarines Sur 2, Capiz State University, Department of Agrarian Reform, Provincial Legal Office, URSP, Bula Central School, Central Bicol State University of Agriculture, and University of Navacáceres. All right, so we have now come to the end of the first part. Let us now proceed to the second part. May I now call on Mr. Jun Favorito, Public Administration student of Ateneo de Naga Graduate School Department.
So good afternoon, everyone, especially to our speaker for today, Mayor Nelson Legacion, and to all those streaming live online via YouTube and Facebook. So first of all, I would like to thank our speaker for sharing to us the actions that they are doing to combat this COVID-19 pandemic. So evidently, the need for e-governance was prop up by this pandemic. So the more the people having restricted mobility due to the fear of contacting virus and government restrictions, the more the need to push on this e-governance so that the government will continue to connect to its employees, the businesses, and the citizens in general. So e-governance is more likely a necessity for us, especially this time of pandemic, rather than just a way to be at par with other countries, because evidently we are way too far behind other countries, most especially Estonia. So in Estonia, almost 99% of the public service are made available online. So except those marriage, divorces, and real estate transactions. So in our neighbor countries, like Taiwan, for example, because of this pandemic, their Ministry of Finance allows taxpayers to file their taxes using smartphones instead of laptops and desktop computers. So hopefully, we will be like them soon. So with this, Mayor, I I just have one question. So yan. So what are the plans of the local government of Naga in connection with e-governance after we overcome, hopefully soon, this pandemic?
Okay. Thank you, June. Thank you, June, for your comment and that particular question. Good afternoon, Eliza, and all other reactors, professors, and everyone attending this webinar. We call this webinar. I have with me Ramil and of course George. So I have to wear my face mask. Now, with respect to your question, and in particular, if we are talking about Isalbar, which we have developed in coordination with NOICA, I must have to tell you that this particular application was specifically designed for contact tracing purposes and all other matters related to COVID-19. And we have made a commitment to the people through an ordinance, and likewise we made the necessary representation before the regional trial court, where a question about the validity and constitutionality of this Isalbar application in connection with the ordinance that was passed by the Sangguniang Panlungsod was made an issue. And therefore, we have to tell the court that the purpose is only limited to such matters related to COVID-19. In other words, if we have already achieved the purpose and if we have already resolved our problem related to COVID-19, then the Isalbar app would have no further use insofar as a limitation on its utilization had been made clear in the ordinance, in the policy that we issued. We were thinking earlier, before the enactment of the ordinance, that probably after the application had served its purpose, and when we are through battling with the COVID-19, that the data therein, that the app developed can be modified for other purposes, for other government purposes. But the temptation did not go that far. And so we have to limit its use, we have to limit its purpose. The commitment we made through the, as written in the ordinance, as written in the policy, and as represented before the court, we have to honor that. Insofar as other application involving other government transactions, we are moving towards that direction of making use of the technology. And so this can be seen, this can be felt now in some services that the government are providing in our city. But I must admit that you are correct, June Favorito, that there's a lot that we have to do to catch up with more advanced countries. in so far as various services that we are providing to our people. Jun?
Thank you, Mayor.
All right, thank you very much, Sir June and Mayor, for your wonderful answer. Now, may I now call on our second reactor, faculty member of Ateneo de Naga and also a public administration student at Ateneo de Naga University as well. May I now call on Ms. Valen Cortez.
Thank you for that. Thank you for that, Mayor. Ateneo LEGACION. Actually, this is just my insight and comment for in the entire process of e-governance. And in the initial stage of the COVID pandemic, it left us Naga City in a creeping dark. If not just Naga City, I think the entire Philippines, right? The entire response is in a trial and error stage, but the disease requires an abrupt solution. I think everyone will agree with me for that. For centuries, Naga City is an economic hub of Camarines Sur, and therefore it is inevitable for the people not to flack Naga. Added factor is the economic interdependence of the city to other adjacent nearby town and municipalities of Naga. These consequently requires connection between and among neighboring towns of Naga City to reverse the adverse effect of the pandemic. Therefore, municipalities in Naga City shall have mechanisms to connect every information that will be significant in mitigating COVID-19. And I also recognize that Naga City and other towns and municipalities is heavily dependent to IATF and national level policies that actually hampers fast-paced response. And another one would be another discussion of you, attorney, was you discuss about how do you combat misinformation. I agree that Facebook is a platform where people can easily access information. But aside kasi from pandemic, we're also experiencing infodemic. And how do we combat this infodemic? And if you still remember in the first phase of the lockdown, there were chain messages na naipagpapasa-pasa ng mga tao. And that actually spread fear sa mga tao. And mahirap yun. And I think it is significant if the city will utilize in a maximum capacity the Naga City website where people can get verified and reliable information. To add, it is significant to make things in a digital method, especially in the services, not just a digitized government documents, but also digital services. Example of which could be a centralized online payment system where there will be minimized movement of people. I agree and I totally understand that in the era of increased need for information technology, it is imperative also to incorporate governance. Expansion of information technology, e-governance is imperative, especially there is a need for a facility where these progressive transformation can take place. To reach and to connect to every Nagueño, and not just to Nagueño, but to every Filipino people, it is significant to have digital inclusion, to bridge the digital divide. It is indeed, we are in a very complex situation and we cannot just simply deduce it into a simplified COVID-19 response, as there are other emerging issues, namely political maneuvers, corruption, and other societal issues. Thank you.
All right, thank you very much, Ms. Valen. And now for our last reactor, may I now please call on Dr. Murillo, an Associate Professor of Ateneo de Naga University.
Okay. Hi, am I audible, Eliza?
Yes, sir.
All right, thank you. First of all, thank you for extending the invitation. Congratulations also to our MPA students, Ateneo, CLG, and Doc Malu for making this event happen. And of course, to our Mayor Nelson Legacion for sharing both his time and insight with us. Especially the discussion about e-governance is really one of those critical topics that we need to highlight, no? Especially in the context of pandemic. Well, to me, as a young member of academic community, understanding e-governance is essentially a matter of understanding the nature of ICT, government-society relationship in the pursuit, obviously, of collective interest, no? While also acknowledging the fact that we are in a turbulent environment where we are constantly evolving, no? And in this era, it is the pandemic. So governance for me, governance for digital world, as I call it, means creating meaningful institutions that become collective action in everyday life of government, private sectors, various citizens, and also organizations. And I think that what Mayor Nelson Legacion is telling us in his excellent presentation, particularly the introduction of e-Salvar and its benefit, no, in mitigating the adverse impacts of the pandemic in Naga City. Mitigating kasi there's already the threat, no, of the COVID-19. I think e-Salvar should be given a chance, you know, just like any other ICT tools. No, we already see, for me, I already see that it's tangible contribution, no, in improving the quality of services and governance in the context of pandemic-related responses and actions. So I think what I can contribute to this particular discussion is my insight. No? I want to highlight one of the continuous challenges of in constructing the digital system in governance. Ito po ay nakabase sa ating initial research works about e-governance. No? In a way, this is also a reinforcement of to what Mayor Nelson has already mentioned earlier. I'll just make it a bit academic. No? For me, again, governance problems for the digital world involve multiple stakeholders. So governments, no, both local and national, can basically establish regulation in local affairs. But these regulations may have no effect because the digital world is also global, yet the problems are local. So the digital world may deal with local problems on a global scale. And because of its global, no, in terms of scope and scale, the decision-making process in digital governance must involve multiple stakeholders. And I think Mayor Nelson keep emphasizing that. No? So it should involve multiple stakeholders and multiple decision centers, as they call it. No? Governments have a territorial mandate, obviously, to solve the problem that are global or local. But again, because problems in digital world are non-territorial, solutions will not depend only on individual government, but on multiple stakeholders who are really involved, no, in the process of governing this, what we call digital world. I think it was highlighted, no, that this information, no, so as we know already, the production of this information by groups in social media pollutes the environment, no, creating tensions, polarizations, no, uncertainty, and even those non-scientific claims. No, sa gitna ng pandemya, we see a lot of that. No, for example, we ask, no, how can a country like the Philippines deal with fake news, no, in its pandemic, no, related response? No, kasi often we see or hear so many non-scientific claims from non-members of scientific community disseminated by the sites and services hosted Keynote in other countries. No? So the Philippine government alone has no control over the content generated in another country or efficient ways to contain its dissemination in a network. It also begs the question, what is the role of social media platforms? I think it was mentioned by Mayor and Valen and June. No? The platforms such as Facebook, Twitter, no, to contain the disinformation. Again, note that the problems are often local, but their scale is global. So, and this is not only in the Philippines, no, even countries like Brazil, no, sa gitna ng pag-responde nila sa problema ng pandemya, narito ang patuloy na threat ng disinformation, na patuloy na nagko-confuse sa mga citizens. So these problems obviously require governance structure with involvement of all actors on a global scale. Obviously, our scope of influence in this discussion is very micro, no? But again, we can contribute to this particular global initiative. No? So the governance structure applied to governing the digital world requires capacities in the complex and polycentric power of digital technologies. No? while there is no single model, I have to highlight that there's no single model for the implementation of a multi-stakeholder approach. There are several ways, in which public problems can be addressed through mechanisms involving the various actors, the whole of society approach in the decision process. And I think that was highlighted by our mayor. The multi-stakeholder or whole of society approach is basically an approach, a tangible approach for solving collective action problems, while at the same time promoting advisory to governments, in implementing policies, et cetera, et cetera. And yeah, you can do this. We can develop formation of forums that bring together the governments, private sectors, and civil society organizations. So building capacities of governance structures to deal with what I call tragedy of digital world, like the disinformation, misinformation, and all those, especially in public health crisis, means enhancing, empowering multi-stakeholder organization that address specific societal issues, or in this case, the threat of pandemic. That's it. Thank you.
All right, thank you very much, Dr. Murillo. That was a very wonderful insight. Okay, before we proceed to the third part, the last and third part, Mayor Nelson, do you have anything to share to the panel of our reactors?
Yeah, well, I need not repeat what June, what Marie, and Dr. Marshall Murillo had said. They're very insightful, valuable, at reflective naman talaga ng nangyayari at mga kinakailangang mangyari o kaya kinakailangang gawin. Napakarami pa ng mga dapat na gawin, hindi lang on the part of the government, but I think on the part of the people. Even the mindset. Ako sana yung parang dasal ko, kapag ka mayroong ganitong pandemic, kapag ka mayroon tayong kaaway na hindi natin nakikita, sana nagkakaisa tayo lahat at tulong-tulong sa pagharap sa ganitong laban. But then, hindi naman natin masasabi at hindi naman talaga mangyayari na lahat kasama, meron dyan na talagang mahirap na makumbinse. Pero sana maintindihan as we go along.
All right, thank you very much, Mayor LEGACION. All right, so let us now proceed to, before that, do you have any follow-up questions to our panel of reactors? Do you have any follow-up questions? All right, if not, let us proceed now to the third part, which is the open forum. So we have here the first question from Ms. Erica Bisenyo from Bureau of Internal Revenue. Her question is, what are the other best practices of other LGUs that the city Naga wishes to adopt?
Other best practices of other LGUs that the city of Naga wishes to adopt. Are we talking in the context of the COVID-19 pandemic?
Yes, sir.
Okay.
In e-governance.
Well, it is not something about the responses that we have to undertake, because I do believe that insofar as this particular matter is concerned, we have done our part. For instance, when we noted a spike in the National Capital Region and the Calabarzon areas, and when we were able to get the necessary data from the Department of Health, immediately, even if it was Holy Week, we took the necessary interventions and control measures in order to address the problem that was at hand. I do not know if you are taking note of the situation, COVID situation in the past. At the start of the pandemic, we had only 7 cases from March 30 up to May 16. And thereafter, from May 17 up to a period of 40 days, we were 0. In other words, we were able to brought down the number. We can say that we were able to curb the COVID-19 problem, and the situation became worse or was aggravated because of certain policy that we disagreed with the national government, but something that we cannot do. Something that we have nothing to do but to adapt. I am talking about the Balik Probinsya program. Sometimes after its implementation, we started noticing the number, the resurgence, and then the increase in number of cases. In February this year, we were able to brought down the number to only around 3% of the positivity rate. Later on, tumaas siya to around 10%. And just 2 weeks ago, naging 18% na po siya. Ibig sabihin tumataas. Ang ibig sabihin po ng positivity rate ay yung percentage of individual who turn out to be COVID positive as against the number of individuals tested. So ngayon, ibig sabihin sa 5, parang may 1. The past 2 weeks, yung average natin ay 17. Pero medyo bumababa na po ito. Itong week na ito, naging 13. And hopefully, we can still bring this down. So we're I think we're doing fine. But then, of course, if we can see some policies, some practices from other LGUs that we can consider and apply here in our city, we will gladly do that. I can still recall that earlier on, there are even policies that we have already implemented here in our city that later on we saw in the national level or in other LGUs that are being adopted. I think we're doing fine. The problem is with respect to the what we can see as a final solution to this problem. Ano po ba talaga yon? Ang tingin namin yung vaccine. The problem is, even if you have the money, hindi siya available. We have already talked to AstraZeneca, we have already talked to Bharat, and now we are considering another pharmaceutical company. But even the national government is finding difficulty in bringing in vaccine to our country. Yung national government nga nahihirapan with mas lalo na tayo, di ba? So, but we are ready. At kapag may dumadating naman, courtesy of the Department of Health, we immediately do vaccination. We have a vaccination facility at the Jesse M. Robredo Coliseum, but we have to follow the approved policy, the approved guidelines in vaccination. We started with the healthcare workers, frontliners, and we are now doing vaccination for senior citizen. Pero siyempre, napakakonti pa yung numero ng vaccine. And for the information of everyone, insofar as Astra, we have ordered 180,000 doses that will be good for 90,000 individuals. For Covaxin of Bharat, we have ordered 50,000. Hopefully, this coming month of June, kapag walang bulilyaso, may darating po sa atin na vaccine. And this is going to help us a lot para makabangon, para makabalik sa dati. Ayan.
Okay, thank you very much, Mayor. We have here another question from Mr. Ryan Macandog, faculty of Ateneo Naga University. So, with the various efforts that your administration have been rolling out in this difficult situation, I think there are still gaps that need to be resolved, like the delayed swabbing, continuous violations of protocols, deficiency in subsidy. So if there are, what programs can we expect the soonest to address these gaps?
Okay. Yung issue sa result ng swab test, supposedly meron tayong RT-PCR modular laboratory. This one was partly financed by the Office of the Vice President. The information I gathered from the team responsible for its setting up and making sure that it becomes operational the soonest ay baka late May pa. Kuha na lang yung schooling na lang noong mga medtech at saka permit from the concerned national government agencies. Totoo na kapag na-delay yung result by even 2 days, 3 days, may malaking masamang epekto yan sa COVID containment strategies and efforts natin. And so, we have resorted to swab antigen. For the meantime, especially yung mga may close contacts for COVID positive patients in a workplace, at saka yung may mga symptoms, agad-agad po ay sinasubject na natin sila sa swab antigen, where the result is becomes available in 15 minutes or 20 minutes time. So that immediately after that, the taking of swab sample for RT-PCR confirmatory testing is done, but the person is already subjected to quarantine and or isolation. The good thing about our swab antigen is that its I think efficacy is 95% and COVID-19 sensitivity is 100%. We're doing that not only here in the City Health Office, but also in the border that we set up in Del Gallego, Camarines Sur. Ang dami na po nating naharang doon coming from Metro Manila, NCR, and Calabarzon area na nag-positive sa swab antigen test At kapag na-subject sila sa swab RT-PCR, ay naku-confirm po talaga na positive. So this is an effort that helps prevent the further spread of COVID-19. So that's for the gap mentioned about the delay in the release of the result of RT-PCR swab test. The other one is, come again, yung, saan ba yun? Yung isang concern. Eliza, yung isang concern ni Ryan Macando.
The deficiency and subsidy.
Deficiency in subsidy. Meaning funding from the national government. Ito nga nakakatawa nito eh. Kasi halimbawa, pagdating sa vaccine, we were expecting that vaccine will be provided by the national government because that had been the case ever since in the case of polio, measles, di ba? Flu vaccine, pneumonia. Ayun naman talaga yung mandate ng national government, ng Department of Health. We were surprised early part of January when we were told by the national government, kayo mga local government units, maghanda rin kayo ng pambili ng vaccine. Dahil sinabihan kami na gano'n, sige, maghanda rin tayo para mapabilis yung pagbabakuna, pagbabalik sa dati. And so we allocated so much. Pero ang problema, ayun, hanggang ngayon, wala pang kulang na kulang. Kakaunti pa lang yung nakakarating.
Okay, thank you very much, Mayor. We have here...
In other words, Eliza, kahit kulang, gagawan ng paraan ng local government units, Naga City in particular, para matugunan yung pangangailangan in order for us na malampasan na ang problemang ito. Kasi ang pagtingin ko, the earlier na malampasan natin ito, the better for everyone, the better for the city. Diba? Kaysa naman magparahintay tayo. Ang dami nang nawawala sa atin. Just last year 2020, di ba, dumating yung COVID-19 ay March na. Pero yung shortfall, ibig sabihin hindi natanggap, hindi na-realize na local revenue ng city. Nasa 150 million pesos. Yun yung nawala. At yung meron ka nang ganun kalaking shortfall, pero ang laki pa ng nagasto mo. More than 150 million for COVID alone. Ang dami pang mga calamities na nangyari last year. So we spent around 200 million pesos dahil lang po sa problema na hinarap natin. At ganoon din yung mangyayari ngayon. Ako inaasahan ko na may shortfall ulit ngayong taon dahil hindi pa natin nasusolusyonan itong problemang COVID-19. At malaki pa din yung gagastusin natin, di ba? Pero kahit gumasto tayo sa bakuna, kung ito talaga yung solusyon at makakabalik ka agad tayo sa dati, o balik yung sigla ng ekonomiya, yung negosyo, yung mga nawala ng trabaho, magkakaroon muli ng trabaho, mas maigi para sa lahat. So hindi bale na gumasto basta't matapos na ang problemang ito. So kahit kulang yung subsidy, kulang yung suporta coming from the national government, gagawa tayo ng paraan. Eliza?
Thank you very much, Mayor. Okay, just one last question here from Sir John Iligay. Okay. What are those actions that the local government of Naga is doing to address the concerns of tenants with small businesses operating within the commercial building whose business has been closed due to the pandemic? So tenants are paying rental fee in full.
Sige. Yung patungkol po kasi sa rental payment, these are matters between the lessee and the lessor. The authority to regulate the same is not vested on the local government units but on the national government. Pwede magpasa ng batas yung Kongreso para ma-regulate ito and to lessen the negative impact or adverse effect, especially on small businesses. Yung ginawa po ng City Government of Naga ay nag-launch po kami noong Business Stimulus Program para ito doon sa mga nahirapan, lalong-lalo na mga maliliit na negosyante, maging doon sa mga nagsara para makapagbukas na muli at para makabalik. Ito po ay zero interest, pwedeng lumapit sa lokal na gobyerno at makatanggap ng 25,000, 50,000, 75,000 or 100,000 pesos depending on the circumstances, depending on the extent of the business, by helping the small business owners. Natutulungan din natin yung kanilang mga empleyado at yung kanilang mga pamilya. Patuloy po ito, marami na po tayong natulungan at patuloy pa din pong ginagawa ang bagay na ito. Hindi lang po yun, meron din po tayong community employment program, ongoing pa din po ito. Para naman po ito sa mga may hirap na walang trabaho o kaya nawalan ng trabaho. May mga ibinibigay tayong trabaho po para sa kanila at siyempre may corresponding payment based on the prevailing minimum wage rate in our city at ilan pa pong mga programa. So yun po.
Okay, thank you very much, Mayor, for answering all of those questions. Now, to show our gratitude, here is a certificate of appreciation. So the citation reads, Ateneo Naga University Graduate School, Master in Public Administration Program, PA211 class in coordination with the Center for Local Governments, awards this certificate of appreciation to Mayor Nelson S. Legacion for unselfishly sharing his time and knowledge as the guest speaker during the webinar entitled E-Governance Naga City, Connecting to its People Amidst the COVID-19 Pandemic, given the 7th day of May 2021 at the Ateneo Naga University, signed by Roma A. Bilano, head of the organizing committee, signed by Malusi Barceliano, Program Director, MPA and MBA Cluster, and also Director for Center for Local Governance, and also signed by Dr. Michael A. Cuesta, Dean of the Graduate School.
Okay, maraming salamat.
Thank you very much, Mayor. We would also like to award the certificate of appreciation to our panel of reactors. The citation reads, Ateneo Naga University Graduate School, Master in Public Administration Program, PA211 class in coordination with the Center for Local Governments, awards the certificate of appreciation to Dr. Marshall Q. Murillo for unselfishly sharing his time and knowledge as panel reactor during the webinar entitled E-Governance, Naga City Connecting to its People Amidst the COVID-19 Pandemic. Given this 7th day of May 2021 at the Ateneo Naga University, signed by Roma A. Villano, head of the organizing committee, Malu C. Barceliano, program director of MPA and MBA, and director for Center for Local Governance, and Michael A. Cuesta, dean of the graduate school. Same certificate of appreciation is awarded to Marie Valen and Cortez and Mr. June Favorito. Thank you very much. So to formally end this webinar, may I now call on Ms. Roma Villano to give his closing remarks.
Thank you very much, Eliza. So let me first take this opportunity to thank everyone who, in one way or another, have contributed for the success of this webinar. Again, in behalf of PA 211 class, our sincerest thanks to our class advisor, Dr. Malu Barceliano, for this learning experience, and also to Ms. Camille and the technical staff. Also to the Office of the Ateneo Graduate School, headed by our Dean, Michael Cuesta, PhD, for the support extended to the group. And of course, to our resource person, Mayor Nelson LEGACION, and to the panel of reactors, Dr. Murillo, Ms. Valen, and Sir June Favorito, for the insights and inputs which immensely contributed to the success of this webinar. And of course, to all the participants who have taken the interest and time to join us in this webinar. It is indeed a fruitful day as we have learned the measures that the city of Naga is adopting to connect to its people and to curb the further spread of the virus by using different technology and platforms. It is again proven that the use of these technologies and tools enables local government, particularly Naga City, to continuously communicate to their constituents the easiest and fastest way possible, despite the ongoing limitations. The utilization of such technologies also warranted Naga City to do more with less, that is, reaching for Nagueños and delivering results with the use of minimal resources for purposes of information dissemination, communicating updates and policies, and even advanced contact tracing methods. It was also recognized that these advancements and technological means better serve their purposes with the cooperation of the different stakeholders of the city. It can be understood that government cannot do it alone without the openness, the willingness, voluntarism, and participation of everyone. This brings us to new meanings of adopting e-governance, particularly by a local government. One is e-governance as effective governance. We're using technologies as operative means to deal with issues and concerns like this pandemic. Another is e-governance as efficient governance, where use of technologies can maximize outcomes and deliverables using minimal resources possible. And e-governance as empowering governance, which fueled our leaders to continuously provide their people with the needed services amidst the adverse effects of this health crisis. This COVID pandemic may have had brought many challenges to public administrators, but the same had also provided opportunities to discover new means of providing a more effective and efficient service. Time will come that this pandemic will eventually pass, but the learning and new adaptations made will carry on, creating a stronger, better, and a transformed governance. So once again, thank you and Majesty Day, everyone.
Thank you very much, Ms. Roma. We have now come to the end of our webinar. Thank you so much for joining us, and thank you very much also, Mayor, for your time. We know that you are very busy Thank you po. And kindly remember to our participants, please do accomplish the evaluation form posted on the screen, okay, to obtain the e-certificates. All right. Okay, thank you very much. Again, this has been a fruitful and a very knowledgeable afternoon. My name is Alyssa Joyce Alarcon. Bidding goodbye and please take care.